My name is Isaac, State Focal Persons for Akwa State, and Chair of the Focal Persons for South Region. And human capital has been a very interesting program from the national to the state level. And at the state level, we have done a lot. First and foremost, we were able to integrate the human capital development initiative into the state development agenda. The Ibom State Development Agenda of His Excellency Pastor Umon, PhD, is the Arise agenda. So we were able to come out with the Arise Human Capital Development Strategy, which was launched by the Vice President in April 14 last year. And we did not stop at the state level. We were able to take this down to the local government level. We had the local government committees at the local government chaired by the chairman of the local government. And then the head of local government service serves as a focal person and the secretary of that committee. And we've taken it down to the ward levels where we have human capital development ward teams, ward and community teams, being led by the councillor of each ward, and the secretary is the PA, personal assistant to the governor, because the governor has appointed his personal assistant in all the 368 wards in Akwa State, so they serve as secretary. So we now have a representative of the village heads of that ward. We have the woman leader in that ward. We have the youth leader in that ward, making up 5 team members in charge of the HCD at the ward now. Their job is to see to the sustainability of the state and local government initiative in their wards, and also contribute to the bottom-up approach to HCD development in the states. Whatever they have, the councillor takes it to the state level, to the local governments, and it being incorporated in the local government and strategic documents, which now puts together from what we call the state HCD strategic document. So that's one thing we have needed to do very strategically. And then the state government in the area of human capital, one of the core areas is health, has built model primary health care centers in all the local government. The primary health care centers are well equipped with modern facilities. We have doctors' quarters, we have nurses' quarters. So you have a 24/7 services to the people in that community. And then beyond that, if state government currently is paying premium of 18,000 naira to pregnant women to be able to access health care through the Akwa State Health Insurance Agency. And it's encouraging councillors, other political appointees, good philanthropists to do same to support the government initiative in this health sector. Sincerely, you cannot go to any local government that will have the functioning model healthcare centers. I mean, where you can carry out operations with modern facilities. It's also doing same in the primary education. We have model primary school in each of the local government. We have the head teachers, we have the clinic for the children. Children are provided with uniforms, shoes, books, and bags. And add to that, the education in the Ibom State is free. We have what we call free and compulsory education policy at the basic level. So the issue of paying for anything when it comes to education in Nigeria at the basic level is not anything to worry about. So the state government has done significant that through paying WAEC fees for our SSCE students, or irrespective of where you come from, provided you are taking that exams in the private state, the state government pays WAEC fee for SSCA students. Then there are government scholarships for those in tertiary institutions, currently supporting all the core members with 20,000 naira, in addition to what the federal government is paying the core members. And even any of Ibom indigenous saving in any other states of inflation, support them with 20,000 naira for them to be able to take. So the government is doing a lot, building a lot of other health tertiary health institution. And currently we are having what we call the health corridor. We've also have the one-stop shop where you have one of the best hospitals in the country. It's all about construction. And then in our tertiary institutions, also upgrading some health institutions like health technology, school of nursing. They are all over. You have them in the three integral districts. Okay, so he's doing a lot in terms of that. And then creation of employment. We have Akwa leadership and entrepreneurship development program where the youths are being trained in different aspects of entrepreneurship. At the end of the day, they are being mobilized to start their businesses with a seed capital ranging from 500,000 to about 5 million naira. So, and then there are also those who are into the transport sector, providing transport facilities for them, like KK, mini bus, for them to be able to do their communities. It's a whole lot. And then, like in agriculture, provide seedlings, fertilizers, and even grants to farmers to be able to embark, especially like the last farming season. He has provided so much for the farmers, from seedlings to fertilizers to extension services through the services of Akwa, and now have a equipment leasing facility at a subsidized rate. For instance, a tractor, instead of paying up to 150,000 for a day's job in a farm, the governor has subsidized it. They pay under 50,000 as against 150,000. So these are his ways, and he has provided these tractors, all this legal farming into these things. So, and many more, and many more.